Hello and welcome to Aging Insights. I'm Melissa Chalker, Executive Director of the New Jersey Foundation for Aging. Since March, we've all been living our lives a little differently due to COVID-19. During the first few months when the stay-at-home order was in full effect, many people were dealing with food security, access to supplies, social isolation, and fears regarding their health, safety, and so much more. Now that the autumn months are upon us, schools are starting back up, either in virtual or hybrid sessions, people are returning to work, more businesses are open, and we have limited indoor dining. As the world around us begins to open back up, what will older adults do? As you've heard others say, this isn't over, but that has more than one meaning. It isn't over doesn't just refer to the fact that COVID-19 is still around and still a threat to our health. It also means that there will be lasting effects for all of us, but especially for those with increased risk factors, such as older adults. I recently had several conversations with some of our favorite experts to ask the question, now what? Over the next 2 episodes of Aging Insights, you'll see interviews with several guests who answer the questions, what risks still exist for older adults, and what lasting impact will this crisis have on them? In this episode, you'll hear from Althea Pestine-Stevens, a Postdoctoral Associate with the School of Social Work at Rutgers University, Paula Span, a columnist with the New York Times, and Amy Bauman, Director of the Piscataway Office on Aging. Remember to stay tuned for tips from Dr. Claire Mulry at the end of this episode, and tune in next month when we continue this conversation about dealing with the long-term consequences of the COVID-19 pandemic. Well, welcome, Althea. So glad to have you join us today and have a conversation. We really wanted to talk with you about social connectedness and what that means. But before we get into that conversation, can you tell us a little bit about yourself and about your work?
So I have a master's degree in public affairs, which is a hybrid public policy and public administration degree from the University of Texas at Austin, where I emphasized program evaluation for nonprofit organizations. I also have a PhD in social welfare from SUNY Albany in New York State, and my current work builds upon what my dissertation work was there. I focus on initiatives that make communities like cities, towns, counties, and states, better places to get older in. These are called age-friendly community initiatives and usually focus on areas of the social and built environments, such as housing, transportation, social inclusion, and civic engagement. My particular work focuses on how organizations within those communities work with each other towards these improvements.
Paula, thank you so much for joining us and taking some time out of your schedule. We really appreciate it. We at NJFA are huge fans of your column, The New
Oh,
Old
thanks.
Age in the New York Times. Could you tell our audience a little bit about your column and sort of what you write about there?
We've actually been doing it in one form or another for 10 years, which is sort of astonishing to me. It began as a blog. I didn't start it. It began as a blog started by another former New York Times reporter. And for a number of years, it was about 3 times or 4 times a week, we would just put up material and people could comment on it. And then about 5 years ago, it switched to a column online and also in the print Science Times section. We talk about aging, caregiving in all of its many dimensions, health, but also work and relationships and different. And lately, of course, all we've been writing about is the effect of the coronavirus
Yeah.
on the elderly population.
Hi, Amy. Thanks so much for joining me today. I'm really appreciative of you saving some time for us so we can have a conversation. I want our audience to know that you're the director of the Piscataway Office on Aging, which means you run the senior center. What do you want the folks watching at home to know about senior centers? You know, what are some misconceptions that you think the public has about senior centers, and what do you want people to know about why they should look into their local senior center?
A senior center is a dynamic place where seniors in the community can go and engage, and make friends, have activities, participate in events, and it is for people that are active and independent in the community. Such as in Piscataway, they must be 60 and they must live in Piscataway Township. And all of our activities and events are free for anyone that lives in Piscataway Township.
That's just terrific, and people might think of it as just a place to come and maybe play bingo or some of the myths about senior centers. But there's so much, like you said, it's vibrant, it's dynamic. There's so much that you can do there. So we really encourage people, even if they don't, or if they aren't lucky enough to live in Piscataway, that they should look into their local senior center and find out what they're doing in their towns, and if they can be a part of that. Even during this time when they can't physically step foot in there yet, they could reach out and see if they're open, like your staff is available for people, right?
Yes, definitely.
Yeah. We know from your work and from lots of other things that have been happening during this time of COVID that the social infrastructure in general is very important to people. But could you explain to our audience what that means when we say social infrastructure?
So I like to think of social infrastructure in two parts. The first is the systems that provide for our social services and quality of life needs, such as education, recreation, food, transportation, even healthcare, and other public facilities, as well as opportunities to engage with one's community, such as through volunteering or civic engagement. The second part is access to those systems. So how do people get the food that they need, for example? Are they able to obtain the education that may or may not be available to them? Transportation in the built environment, including safe sidewalks, benches, and pedestrian crossings, play a huge role here, but also are the people with needs being connected to the available services and resources?
You wrote a really interesting article about older adults calculating their risk for coronavirus and what that meant for them going out to the grocery store or out to dinner or meeting friends or family. And so I found that article really interesting because I think it's one of the things as we sort of see places reopening and governments making decisions about reopening that people
Right.
will have to continue to take in mind. So could you tell us a little bit about that article and what went into writing it?
Well, while I was watching all of this happen, it occurred to me that really in the very early days of the pandemic, when we didn't know much about this virus or its effects, um, we had a simpler set of choices, right? It was very straightforward. Just stay home. Just stay home. Don't go
Mhm.
out except to get food or medicine, or you can take a solitary walk, but otherwise just stay inside. So it was not pleasant, but it was easy to figure out what to do, which was basically nothing except stay in. But then, especially in New York and New Jersey and the Northeast, as the worst of the losses and the illness and the hospitalizations began to ebb, and slowly and businesses began to reopen, uh, different categories of activities began to reopen, then it all got much more complicated because now it wasn't binary, just stay home or go back to normal. Now there were a whole set of calculations for everybody, but especially for older people because we're not at higher risk of getting sick, but we are we're not at higher risk of getting the virus, but we are at higher risk of getting very sick from it. So now we have to come up with all these micro calculations, including things like, well, geography. Like, where are you? So we've been very lucky and very determined in New York and New Jersey. I live in Montclair, to have brought the level of infections down, the level of positivity down, the hospitalizations down. So we might make different decisions than people who live in Iowa or California. Then we have to think about our own health profiles. So I don't have any underlying conditions that would make me more vulnerable, but I am 71. So that puts me in, if I were 78 and I had heart disease, diabetes, chronic obstructive pulmonary disease, then that would be a different set of calculations. So it's where are we? What's our personal risk? And then third, I guess something that no one else can tell you, which is, well, what's important to you? Like, what do you really care about? What makes your life worth living? So I am going back next week to teach my classes at the Columbia Graduate School of Journalism, and we are hybrid. So I am teaching online and also in the classroom because that's really important to me. And there's all these precautions about how to make it safe, but it's not as safe as not going. But I'm going to do it because it's important to me. And the other thing that I do is I provide childcare 1 day a week for my 4-year-old granddaughter because that is hugely important to me. It is not so important to me that I go into a restaurant or a gym. So everyone was going to have their own set of calculations, and it makes everything in some ways more complex, but it also gives us back some of what we lost. I can't complain about it. It's just different, harder.
You know, this has been a real disruption with everyone dealing with the COVID-19 restrictions. And so could you talk a little bit about how that did disrupt the social infrastructure?
So, for a start, many services were disrupted, if not canceled altogether. I'm sure everyone has their own experience of something that they were not able to do the way that they had done before.
Mhm.
Some things that are particularly salient for older adults include that non-emergency medical visits were cut for a long time, pushing back many older adults from being able to receive care for prevention and ongoing conditions. In the age-friendly community initiatives, we talk a lot about food and about recreation and fitness.
Mhm.
For example, congregate meals are one of the largest federally sponsored nutrition programs, which provide not only regular nutrition for older adults, but also opportunities to socialize with their peers. When these were cut early into the pandemic, older adults were left not only without their regular hot food, but without access to their friends and other community members with whom they regularly connect. Home delivered meals also suffered from a unique situation. Many of the volunteer drivers are themselves older adults,
Mhm.
many of whom were isolating due to COVID concerns. So not only were older adults who were receiving home delivered meals no longer receiving their much needed nutrition and daily or weekly social check-ins, but the older adults who volunteered were no longer getting their social connectedness and sense of meaningful engagement through volunteering positions. Older adults are not immune from the effects of racial and economic injustice. According to the American Public Health Association, persons of color are more likely to be essential workers and also to contract and die from COVID-19. Persons with lower socioeconomic status, such as those deemed to be essential workers, are also less likely to be able to retire as they age, and these are people are disproportionately people of color. They must continue to work because they rely on the income from their job. They don't have necessarily retirement savings. These older adults do not have the luxury of being able to isolate, and our attention must also turn to their safety, health, and justice.
I'm sure difficult for you and your staff to be missing your regular participants who don't really come to the center, but it sounds like you've been doing a really good job of trying to stay connected to them. How else have you been trying to meet their needs still and some of the other activities the senior center would help with, like transportation for shopping and meals and that sort of stuff?
Well, we do offer shopping and medical appointment transportation during the week. It is suggested donation of $10 if your appointments are outside of Piscataway. If they're inside Piscataway, they're free. And our drivers have been working continuously through this pandemic to assist them in any need they can do.
And I understand the drivers have been taking the necessary precautions to make sure everybody's safe, right? So could you tell us a little bit about how they're doing that?
Well, they are wearing masks when they're on the bus, and they're sanitizing the vehicles each time that they end up finishing with a run. They sanitize them. And we make sure that everyone has a mask when they get on the bus as well.
And one of the big features of the Senior Center is that people come for lunch or different things. So how have you been trying to meet that need for folks during this time?
We have been assisting Middlesex County Office on Aging nutrition program with delivering Meals on Wheels to all the residents in Piscataway that were either receiving their Meals on Wheels and also received congregate meals here at the center. And we're doing that on Mondays and Thursdays each week, and we're bringing them 5 meals a week. And we're also bringing them meals for the weekend at times.
Age-friendly community initiatives, for example, have built upon their relationships with other organizations in the community to create innovative responses to these needs. Some new partnerships have been made and new grassroots organizations formed as well. Some innovative responses include purchasing large quantities of food from restaurant suppliers to portion out to older adults in the community, as well as new free farmers markets springing up with partners that include mixes of farms and various local food pantries, all working together. We also see organizations that have the knowledge or resources for organizing and creating programs, working with those who have ideas and audiences for programs to create virtual fitness classes and social gatherings. Libraries we've seen have been key partners for these types of activities.
people who live at home and not in nursing facilities might be dealing with social isolation and loneliness that you mentioned earlier. So, we have to keep that in mind too, because the indoor visits, if people aren't comfortable with someone coming in their home, are also going to impact them and
It is. It is.
their mental well-being, right?
Well, we know that isolation has real impact, not just on your psychological well-being, but on your health. And people who are isolated have higher rates of illness. They have uh, all kinds, in addition to depression and anxiety, it is as harmful to older people to be isolated for an extended period as it is to smoke or be sedentary or have other health habits that aren't healthy. So h- and so yes, people have been calling and using video, but it's hard to know how can we not let people sit at home alone, which is as bad as sitting in your nursing home room alone. Maybe, in some cases, maybe Meals on Wheels volunteers can be a sort of ambassador. Maybe in some families, you do testing and your bubble, your pod includes an older person. So you stay away from other people this winter, but you go and see your mother or your aunt indoors with a mask. Maybe that's how you handle it. I mean, it's something we're all going to have to be dealing with because we have to, because we can't forget that other things besides COVID can be dangerous.
True.
One thing that the COVID-19 pandemic has provided in particular is the shared experience of social isolation among people of all ages and mobility capabilities. So now that we all know what it is like to be isolated, we have a shared empathy for people whose isolation began long before the pandemic and will continue into the future.
An alternative to getting together in person if that's not an option because outdoor is preferable and the weather will not be amenable to that. Then this what we're doing, right? Video chatting
Yep.
and the world of Zoom and all these things that people have gotten comfortable with. Will that become the alternative to getting together in person? And what impact does that have for older adults?
There's been a real stampede onto these video chat platforms by older adults. A number of people have already used them. They use FaceTime to stay in touch with their grandchildren. But this spring, we saw lots of people having Easter egg hunts and family seders by video chat. So I don't think that's going away. That's going to continue. We're also probably going to be using it for our healthcare more because telehealth also took a big jump during the pandemic when people were nervous about going to their healthcare providers in person. And when we thought about it and when various medical groups discussed it, it did turn out that a fair amount of what we go and see doctors and nurses for could be done by phone or on video. And Medicare decided to cover that when it had been debated for many years. So that may continue also.
How can we make sure that those you mentioned just a minute ago that there were some people who were isolated before the pandemic? So how can we continue to make sure that this gets highlighted as a concern? You mentioned some of these great partnerships and innovative things. So how can we make sure this stays part of the conversation and that this people don't get left behind and that we can talk about overall wellness that includes social interaction?
Yeah, one implication that's very clear to me is that we need more equitable access to safe and remote opportunities for connecting with each other. It can be challenging, in particular, for older adults who were already isolated prior to COVID-19 and we're not being connected to each other. We're not being connected to the social infrastructure before. But now we've been developing these systems. So they may not have had access to the appropriate technology in the past. They may not have had the way to connect to these social institutions, but we are developing these things and we need to be able to get these to the people that need it the most. Another population that could be particularly vulnerable here are older adults with chronic health conditions, who are probably going to be decreasing their connectivity as they fear more about going out and being around other people, and are likely to choose to remain isolated for longer. Those who have also recently lost a loved one could be particularly vulnerable in this case too, because that's also a risk factor for isolation anyway, regardless of, before the pandemic started, we knew that. So we need to have outreach efforts that target individuals in these groups in particular. And as you said, we know that social isolation impacts wellness from many dimensions of health: social, behavioral, mental, physiological. It is clear to me that these need to be integrated into wellness plans from a variety of angles. We should include social isolation screens commonly in our healthcare practice, along with appropriate interventions. I have seen that there are organizations that have been working on adapting their evidence-based practices related to these social services and social connectedness challenges to be implemented remotely. The National Council on Aging, in particular, has been a leader in this area. Some of their programs, for example, aim to treat depression, other chronic disease management, and encourage active lives, wellness, and caregiver support. And these have all been, they're working on making them able to be implemented remotely through telehealth and through other socially distant, physically distant, but socially
Yes.
connected
Yeah,
ways.
I did notice recently that something I was watching on TV, I guess it was a commercial, and I have seen people shifting to use physically distant. And I think that's such an important distinction because, right, you can be physically distant from someone, but still be social and still have that social connectedness, right? So that we started with this phrase social distancing, but that sort of has this underlying thing of, oh no, wait, I can't talk to you or we can't connect, but you can still do that and remain a safe physical distance for your health concerns, right?
Absolutely. And, we're still going to be learning about the ways, the ways that the ways to be remotely connected with people socially. We're still going to be learning a lot about the ways in which they work and function and whether it is a good substitute. And, there's going to be a lot of study and reporting on that, I think, in the future.
Yeah, lots of opportunity for research here, for sure. What's been going on at the Senior Center since the shutdown due to COVID?
Well, Melissa, we have been closed since March 13th, and my staff have worked very diligently on calling all the seniors to make sure that they're okay at home, and also by sending emails to them. We also were very fortunate that PCTV invited several of our teachers to come in and film their classes here. And we've been showing their classes regularly so the seniors can participate at home on some of their classes that they've been missing.
Exercise programs, you have a very active Taekwondo group, right? And so there was a video for that that's available online. What's been the response to those? Are the seniors enjoying watching those at home?
Oh, definitely they do. And we also had line dancing and ballroom dancing. And we also have a seated exercise class that they're able to watch.
Yeah, that's great because it offers a real variety and allows people to take part in something at home that they were doing in person at the center. So it's just a wonderful relationship that you're fortunate to have here for that. So while the seniors can get their meals delivered, they can watch videos online, but your staff is here physically in the center every day, available by phone for them. Is that right?
Yes, they are. They are here 7 a.m. to 3 p.m., Monday through Friday. They are here to give any seniors any kind of guidance or resources that they may need at this difficult time.
Yeah, so that's really great to know that they can't come in and see all of you, but you're just a phone call away still. If they have a question or a concern or they don't know how to access a benefit, your office is still there for all of those things, right?
Yes, and our elder care coordinator is available too, like if there's any kind of issues that family have that, that they're going through, such as maybe questions about assisted living or nursing home care, or maybe some help at home. We're here to give unbiased options to individuals in the community.
So what about reopening? Are you receiving any guidance? Do you have any thoughts about when or how you'll open back up and welcome seniors back to the center?
Currently, right now, we are following the CDC guidelines and the governor's executive order. And also myself and our administration have been meeting with other directors in the county to find out what they are doing. And right now at Piscataway, we do not know when we are opening yet.
It's such a hard time, I'm sure, for you and your staff to be missing your regular participants and to not be able to do that. But I'm sure that you're going to keep an eye on the things as they progress and let everyone know when you'll be ready to open the doors and welcome them back to join you. So,
Yes.
yeah. That's just terrific. And I'm glad that you mentioned, communicating with other centers within your county, because at the end of our show, we always give the hotline for finding your county office on aging. And that's easy because there's 21 of them, so they're easy for people to reach out to. But that's another resource for folks to find out what senior centers are in their area and find if they can't call their township directly, call your county office on aging and they can say, oh, you're closest to this center, and make sure you check them out, right?
Yes.
Terrific. Anything else you want our audience to know, Amy?
Please check out your community senior center. You will be surprised and amazed at what your local senior center can do for you. You could go in one day a month. You could go in every day.
Yeah.
There's something for you.
Terrific. Thank you so much for joining us, Amy. I'm really glad that you could share this information with our audience.
Today's quick tip is about your COVID-19 worries. We are living in a global pandemic. Do not take that for granted. It is putting a lot of stress on all of us every day. But there are some quick tips that can help you. One is wear your mask. Two is keep your space and don't touch your face. The other thing is reach out. Call a friend a day. Do something you love every day. Plan it so that you are spending time not worrying about this time. Making sure you do some leisure and reaching out to neighbors, friends, and family is a good tip so that you stay safe and less anxious as we go through this time together. Be well, stay safe. We'll get through this together.
Thank you for watching this episode of Aging Insights. For more information and to watch previous episodes, please go to our website at www.njfoundationforaging.org and click on the Aging Insights page. We hope you enjoyed this episode and that you feel more informed about how to handle the ongoing COVID-19 pandemic. And remember, to find out about senior services in your area, please contact your county office on aging. Their numbers are on our website, or you can call the state hotline at 1-877-222-3737. They're here for you. Thanks for watching, and be sure to tune in next time.